Let's talk about bike injuries. Biking can be a great family activity and a great source of exercise, and just a lot of fun for your family in the summer. At the same time, bikes are fast. A lot of times you're going on concrete, and a fall can be a devastating injury. You can have fractures, traumatic brain injury, and we don't want to see that. There's a few things that we can do to hopefully prevent some of the injuries. One thing is just wearing a helmet that fits, a helmet that your kids like. That in itself will prevent a lot of injuries. Now, we as a family go out a lot. There's trails near where we live, and we take the bikes out. It's one of the things we do. As an emergency physician, I have stopped doing many dangerous activities. I don't know that I consider biking super dangerous, but it's one of the things that I can't give up. And so we go out as family and do this. And last month we went out, and my 7-year-old, God bless him, fell off his bike as we're going down the hill. We were probably going a little too fast. There was some gravel. He went right into a telephone pole, and he was lucky that he was wearing his helmet, because a lot of times he doesn't. So a few things that I kind of learned from that was make sure that your child is comfortable with their bike. It was a new bike. The seat wasn't probably adjusted appropriately. His shoelace also got caught in the chain. All things that you can kind of make sure that they're doing, or that you do as a family. So as a parent, there's a few things that you can do to make sure that any accidents are prevented. Now, one, if you do have an accident, wearing the helmet goes without saying. Probably the most important thing, a helmet that fits, a helmet that the child is going to want to wear, so that if there is an accident and they hit their head, it's not severe. Second, making sure the clothing is tight, not loose. Same with shoelaces, not getting stuck in the chain, which is going to cause them to fall. And third, making sure the bike is ready to go, having the tires aired up, having the seat adjusted, the handlebars right, fit for that bike. My kid fell because the bike, he wasn't used to it, it wasn't fitting him right. And lastly, I think having good rules of the road, right? Teaching your kids to cross only when it's appropriate, and to cross with your help, to watch out for cars, to use signals, and not to do horseplay with brothers and sisters while on the road. All those things will prevent serious bike injuries. We can't prevent all accidents. We can't prevent all bike injuries. So if you do have one, please come in and see us. We can take care of you. We have CT scan to rule out clinically significant brain injury. We have x-ray. We can make sure you don't have a broken bone. We can also take care of any wounds you might sustain when falling off the bike, abrasions, lacerations, and lastly, we can take care of your pain. Don't hesitate to come see us. We're open 24/7 right here at Complete Care.
Complete Care, the ER with a heart.